Here's a question we mentioned before. For pregnant women, it's a big decision whether to C-section or not.
Well, sometimes it's not a decision.
Well, when it is a decision, there's some interesting information on this. And Lauren is here right now.
Lauren, you have 3 babies. Have you ever had a C?
No, never had a C-section, but it's always a big question. Do you just go natural or do you schedule the C-section? You know, and I know a lot of women who just go, you know what, I want to schedule it. I feel better about it. And I'm here with Dr. Ahluwalia to tell us, because some women, they're saying this new study that when they schedule this C-section, they're actually happier.
Yes. So this study came out recently, and they looked at women who were undergoing scheduled C-section versus women who were having natural childbirth. And they found that women who had scheduled C-section were more satisfied and happier. And you know, I think some of the unsettling feeling is when you go into labor, you don't know how long it's going to be, you don't know if you're going to need an emergency C-section. There's a lot of variables.
And then you're in your first-time mom, you're like, okay, am I in labor? I don't know. And
exactly.
if you schedule it, like, you're fine.
Exactly. So, but I don't think there's a right or wrong answer. I don't think everybody falls into the same place. So there's individual circumstances. Talk to your OBGYN, make an informed decision. I think that's the most important thing.
Okay, let's talk about more important things.
Yes.
It's summer.
Yes.
Tanning. What do? Should we go in the sun, get tan? Should we go in the tanning bed, or should we spray tan, or none of the above?
Correct. The answer is none of the above.
Well, that's not happening. So give me an alternative.
Yes. So we know that ultraviolet light causes melanoma. So there's skin cancer risks with ultraviolet light. But I think that with the spray tans, the risk is the lowest. And I think that, you know, unfortunately, we don't have any studies to look at the long-term risks and benefits of doing spray tanning. Now, it has...
But the benefits of this video are good.
Yeah, exactly. But, you know, there's an ingredient in the spray tan that may cause free radicals. We're not sure. So I think the advice is use it sparingly, use it in the body parts that are exposed, and don't do it all the time.
Okay, so yeah, because we don't know what's in it, and pregnant women are getting spray tans.
Exactly. So we don't know. That's the answer. We don't know.
We don't know what's in it, but we're sending Lisa Breck to get spray tanned in just a minute.
Yeah.
But okay, last question. Salt. A new study came out saying that salt isn't as bad as we first thought.
Right. You know, this is a study that was published in JAMA, which is a very recognized journal, and it flies in the face of everything that we've been saying for decades. And you know, the study has some flaws in it, and so we're not buying it just based on one study. We're not changing what we recommend.
Oh, so there's no changes yet? No
changes yet. You know, all the organizations have stuck to what we've said before. Low salt is better. People who are hypertensive, people who have high blood pressure, people who have heart problems, don't eat too much salt. It's important. I think the study had younger people. They didn't follow them for as long. And
I like that you said 40 was young. I liked that.
Yeah.
The study, it was 40
is young.
I like that. I like that. Dr. Ahluwalia, thanks so much. So,
Absolutely.
Steve, this is basically the bottom line. If you're pregnant, get a C-section. If you want to have a margarita, have it without salt, and you have to have it in the shade.
And go pale.
And what?
And go pale.
Yes, exactly.
Yeah.
It's so funny when